Vitamin D is one of the most commonly used supplements today. People take it for bone pain, low immunity, fatigue, and overall health. But here is something very important that most people don't know. You should never take vitamin D alone. Many people take high doses of vitamin D and still don't feel better. Some even feel worse after starting it. The reason is simple. Vitamin D does not work on its own. Vitamin D behaves more like a hormone than a regular vitamin, and hormones always need supporting nutrients, known as cofactors, to work properly. When these cofactors are missing, vitamin D cannot activate correctly and may create imbalances in the body. The most important cofactor for vitamin D is magnesium. Magnesium is required at every step of vitamin D metabolism. Your body needs magnesium to convert vitamin D in the liver, activate it in the kidneys, and allow it to function inside your cells. If you take vitamin D without enough magnesium, your body will pull magnesium from muscles, nerves, and even the heart. This can lead to muscle cramps, anxiety, poor sleep, constipation, headaches, fatigue, and heart palpitations. Many people say vitamin D doesn't suit them. In most cases, the real problem is magnesium deficiency, not vitamin D itself. The second critical cofactor is vitamin K2. Vitamin D increases calcium absorption from the intestines, but calcium needs proper direction inside the body. Without vitamin K2, calcium may settle in the wrong places, such as arteries, joints, and kidneys. This can increase the risk of arterial stiffness, joint pain, and kidney stones. Vitamin K2 helps guide calcium into bones and teeth, where it belongs, and keeps it away from soft tissues. If you are taking vitamin D, vitamin K2 is essential. There are also other cofactors that support vitamin D function. Zinc is important for immune response. Vitamin D supports immunity, but zinc allows immune cells to work effectively. Boron helps extend the activity of vitamin D in the body and supports magnesium balance. Vitamin A, when taken in proper balance, works together with vitamin D at the genetic level. Too much vitamin D with very low vitamin A can disrupt hormonal signaling. Healthy fats are also necessary. Vitamin D is fat-soluble, which means absorption is poor without dietary fat. Taking high-dose vitamin D alone can create problems instead of benefits. Many people take weekly or daily high doses without supporting nutrients and experience fatigue, calcium imbalance, muscle pain, or worsening symptoms. More vitamin D is not the answer. Balanced vitamin D is. The correct approach is to view vitamin D as part of a nutrient system, not a standalone pill. Vitamin D works best when combined with magnesium, vitamin K2, zinc, boron, adequate vitamin A, and healthy dietary fats. This is how the human body is designed to use it. If vitamin D truly worked alone, millions of people would not remain deficient despite supplementation. Healing does not come from megadoses. It comes from balance and nutrient synergy. Before increasing your vitamin D intake, ask yourself one question. Are you giving your body the nutrients vitamin D depends on? Because vitamin D alone is incomplete. True health begins with cofactors. For holistic, root cause-based wellness guidance, visit Innate Heal, where healing begins from within. Please like, subscribe, and share the video to your family and friends if you like it.